Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today I am going to touch on an important topic, that is genetic inheritance. And also I am going to brief some basics of chromosomal anomalies. Please remember these important points. Passing the trait to the children is called inheritance. What is inheritance? Passing the trait or the qualities to the children is called inheritance, because you inherit a lot of properties to your children. At the same time, you transmit your tendencies, that is trait, to your children. That is called inheritance. But in terms of diseases or the genes, it is called genetic inheritance. Genes determine the trait or that means quality of the individual. A set of genes that decide the trait is called genotype. Genotype. Genotype is determined by a set of genes, okay, which determine the trait, and that in turn is transmitted to the offsprings. Well, the trait could be physical, behavior, or any features of the individual. Gene is the fundamental segment of DNA. Please understand this particular term. Then, DNA is long polymer, a double-stranded structure, double helical structure that encodes the structure and functions of a protein. And so, the genetic information that is passed on to the generations. Okay? The condensed strands of DNA in the nucleus of the cell is chromosome. Where are the chromosomes? Chromosomes are located in the nucleus of the cell. They are formed by the condensed DNA molecules, maybe thousands or millions of DNA molecules condensed together to form the chromosome in the nucleus of the cell. You got it? Then, locus is the point on the chromosome where a gene is located. Okay? Locus, the gene located in the long arm of the 22nd chromosome. And that locus determines the phenotype of the individual. So that's how it is. Locus is the point on the chromosome where a abnormal gene is located. Normal or abnormal gene, whatever it is. The gene, genotype, through which we understand that particular inherited disorder is the locus. Okay? This is the double helical structure, that is DNA. This is again the picture showing this DNA molecule. This is the pattern of inheritance. You see, the circle represents female, the square represents male. They are wedded together. Female is suffering from the disease. Okay? And it is inherited. I mean, it is transmitted to the next generation. How it is transmitted? Say, look, they have got one child here. Okay, one, two, three, four. Out of four children, there are three are affected. This generation again, there are diseased individuals. In each generation, there is one member of the family affected. Okay, because the disease is transmitted from one generation to another generation, and there is an individual suffering, inheriting the disease in each generation. This is called vertical transmission of the disorder. Remember these slides when you are talking about the modes of inheritance. Here you see the individual is half shaded here. That means they are carriers. When both the parents are carriers for the disease, okay, they do not manifest the disease, and there is only 25, the one out of how many children they had? 1, 2, 3, 4, and 5. Out of 5 children, there is one child inherited the disorder. Okay? This pattern of inheritance is recessive, autosomal recessive. You remember these slides, then we are going to discuss the features of the various types of inheritance. This is another type of inheritance. Here, say, females are not suffering from the disease. There is males are affected here. You see, this is the 1, 2, 3. In this pedigree, all males showing the disease, affected by the disease, and the females are non-symptomatic, not symptomatic. They are carriers, and the disease is occurring in the males. Males are predominantly affected, and the females are carriers. This is what type of inheritance? This is sex-linked recessive inheritance. Okay, after gone through these particular pedigree charts, let's go into the real topic. Genetic disorders are the diseases associated with the partially or completely altered genetic material. That is, partially or completely altered genetic material is responsible for the genetic disorders. Familial disorders are the diseases that occur in the family more frequently than in general population. It could be genetic or environmental factors. What is pedigree? Diagram of the family history and relationship of the family members with regard to the patient. It is a diagrammatic representation of the pattern of inheritance of the disease, mentioning the relationship of the proband with the rest of the members of the family. Proband is the patient through whom the family is affected. First degree relatives are the parents, brothers, sister, and children. They inherit half of the genetic material from the proband. Second degree relatives are those, that is, grandfather, grandchildren, aunt, uncle, niece, nephew, etc. They inherit 1/4 of the genetic material of the proband. Then coming to the modes of inheritance. They are divided into autosomal dominant, autosomal recessive, X-linked recessive, X-linked dominant, multifactorial, okay, non-traditional pattern of inheritance, okay. Okay, coming to the autosomal and X-linked pattern of inheritance, they include Mendelian form of inheritance, okay. Autosomal and sex-linked pattern of inheritance are described by the Mendelian. They are the Mendelian pattern of inheritances. William Mendelian is the 19th century monk. He proposed the principles of genetic inheritance. Okay, that way we remember him to describe the autosomal and sex-linked pattern of inheritance in the name of Mendelian inheritance. What are the autosomal disorders? Altered gene is located in any one of the 22 pairs of autosomes. They are the autosomes. Other pair is the sex chromosomes. That means disease is due to the altered gene in any one of the 22 autosomes. They could be autosomal dominant or autosomal recessive. My dear students, you must understand and remember the various features of these types of inheritance. Say about autosomal dominant. What are the features of autosomal dominant inheritance? Number one, heterozygous state manifests. Now, what do you mean by that? That means one gene is normal, another gene is abnormal. This particular situation is called heterozygous state. Okay? Individual with this situation, that is one normal gene, one abnormal gene, that is heterozygous state. Then the disease manifests in the heterozygous state is called autosomal dominant type of inheritance. That means the abnormal gene is suppressing the normal gene. Okay, it is dominating to express the disease. That means functions of the normal gene are not that adequate to carry on the functions of the particular protein. Okay, it is dominated by the abnormal protein caused by the mutant gene, right? The disturbance in the that is caused by the abnormal protein, which is the result of the abnormal gene. Okay, it manifests. That means this particular gene dominates the functions of the normal gene. That's why it is called dominant inheritance. Appears in vertical pattern in the pedigree with one affected individual in every generation. If you look at the pedigree, there is one member affected in each generation of the pedigree. That is called vertical pattern of inheritance. 50% risk in every child if one parent is affected. Okay. Phenotypically normal family member do not transmit the disorder to the offsprings. If the parents are normal, okay, and they are unlikely to produce abnormal children. Males and females are equally affected because it is autosomal inheritance. Other features are new mutations are common in autosomal dominant inheritance. That means parents are normal, but the child is affected. It is because of the new mutation that has occurred in the offsprings. Variable expressivity, wide variation in phenotype from patient to patient. Every individual who is diseased, okay, with the dominant autosomal dominant inheritance, they do not show the same phenotype. There is variability. Variability in the spectrum of manifestations. That is called variable expressivity. Incomplete penetration. That is, diseases have the features either full or none. That is because of the phenomena absence of clinical features in obligate carriers. Autosomal mosaicism. This is because of the germline mutation. And there will be one normal cell line and another is abnormal cell line. The mixture of these things is called mosaicism. And the clinical manifestations will have less severity in an individual with mosaicism for that particular genetic abnormality. Then look at this picture. This is the pattern that is seen in autosomal dominant inheritance. One of the parent is disease. There is, in every generation, there is one or two members affected. There is vertical transmission. Okay. Here in the, yes, there is, out of 4 children, 2 children are affected in the second generation. Okay. That is the reason why there is 50% risk for the children to be affected. This is again the first generation, the members are normal, members in the second generation are normal, but there is a new mutation in third generation, and that is autosomal dominant disorder, showing the two of their children being affected. There is vertical transmission, that is third generation, there is a abnormal phenotype. There is 2 of the 4 children in the fourth generation showing the disorder. Then neurofibromatosis 1 is an example for the autosomal dominant inheritance. What is autosomal recessive inheritance? 2 copies of the mutant gene in homozygous state required to produce the disease. Okay? It needs 2 abnormal genes to produce the disease. That means homozygous state manifests. And heterozygous state is carrier state. Autosomal recessive disorders are less common, but carrier state is more frequent in general population. So beware of the carrier state of the autosomal recessive gene in the community. And getting wed to a person with carrier state is very common. But this is more common in consanguineous marriages. When both the parents have got the carrier gene, carrier state, there is risk of 25% of the children becoming diseased. So that is the reason why consanguineous marriages are not encouraged. Here, males and females are equally affected. Display a horizontal pattern of pedigree. Okay, chances of carrying identical mutant gene in parents increases in consanguineous marriages. Heterozygous carrier is advantageous in terms of survival from severe malaria. Severe malaria is less common in sickle cell carriers. In the same way, cystic fibrosis carrier is resistant to E. coli or cholera infections. That means carrier state is protective. Okay? Carrier states are protected from complications of severe malaria. That means the individuals with carrier state of the autosomal recessive inheritance, they survive longer in the community because they are not affected by the complications of severe malaria. Okay, that is the reason why carrier state of the autosomal recessive disorder are more common in the community. Right? So there is every danger of getting wed to a person with carrier state in the community when you are going for consanguineous marriages. So don't go for consanguineous marriages. That's what it is. Here the picture shows one pair of autosomes which are normal, one abnormal gene because marked by cross here. The square indicates male, circle denotes female. This half-shaded pictures show the heterozygous individuals. When this fully shaded indicates the affected individual. Is look into this pedigree. There is here the father is carrier, here is mother is carrier for the disease, and here there is mother and father are carriers for the disorder, and there is one out of their four children is affected. Okay, this is the pattern of inheritance for autosomal recessive disorder. This is the consanguineous marriage. Both of them must be carriers, so the 25% of the individuals are affected. You see, this picture shows number of individuals suffering from carrier state. When they get wedded with the consanguineous marriage, they had two of the four children deceased. This picture indicates carrier state of the autosomal recessive gene is more common in the community. When you go for the consanguineous marriages, there is a likelihood of having the children with autosomal recessive disorder. Then, coming to the sex-linked inheritance. Altered gene is located on the X chromosome. Recessive inheritance is common, dominant inheritance is less frequent. Okay? What are the features of X-linked recessive inheritance? Incidence is higher in males than in females because deceased X chromosome, okay, there is no similar gene allele to compensate the phenotype, abnormal phenotype of the abnormal gene located on the X chromosome. Okay, because there are two X chromosomes and a pair of alleles in girls, whereas the boys will have only one X chromosome and it is not associated with the similar gene because there is only one gene that functions on the X chromosome. When this becomes defective, the disease manifests. So the way X-linked recessive inheritance is incidence higher in males than in females. Females are compensated by the normal gene, but whereas the boys have the one X chromosome with one abnormal gene, that becomes manifest. The affected male transfer the defective gene to all his daughters. So daughters receive their X chromosome from their father. Okay, father has got only one X chromosome which is defective. So that's why father transmits the disease to all his daughters. Okay, none of the sons of the father is affected by the X-linked recessive disorder. This is the important feature. Right. Affected male transfer the defective gene to all his daughters, never to his son. Son inherits the Y chromosome from the father and X chromosome from the mother. Okay. So sons are not affected. If son inherits the X chromosome with defective gene and the mother is carrier for that particular disorder, okay, it is the son that inherits the disorder from carrier mothers, okay, not from the deceased father. Daughter son has 50% chances of inheriting the gene. Okay, father transmits the abnormal gene to his daughter, and the daughter will in turn transmit the disorder to 50% of their sons. Okay, that's how it is. Gene is transmitted through series of carrier females. The affected male is related to through affected male is related through the carrier female. It is from the carrier female the male receives the disorder in autosomal or sex-linked recessive inheritance. Sporadic cases are due to new mutations. Well, look at this pedigree. The male is deceased, father is deceased, all the sons are normal, females are the daughters are the carriers. In turn, in the next generation, male is affected, female is carrier. So that is, male gets the abnormal gene through carrier females. There are certain situations where the female may be affected. What are they? Both parents carry the X-linked recessive inheritance. I mean, X-linked recessive allele. That is abnormal gene. Consanguineous marriages is again a risk factor to have both the parents with the X-linked recessive allele. This particular situation is more common in consanguineous marriages, rare in general population. The Turner syndrome is one situation wherein female may be affected because there is random disintegration of the normal X chromosome. This is called skewed X inactivation pattern. Okay, that results in the female being affected by the X-linked recessive inheritance. Well, hemophilia is a typical example of X-linked recessive inheritance. Inherited has X-linked recessive pattern. Carrier female has 50% chances of transmitting the mutant gene in each pregnancy. Sons receive the mutant gene, manifest the disease. Daughters are the carriers. The affected male transmits the gene to all his daughters, but to none of his sons. This is the feature of sex-linked inheritance. What is X-linked dominant inheritance? Heterozygous female regularly express the disease. Okay? Both male and female offsprings are affected. Female has 50% risk of inheriting the disorder to the children. Affected man transmits the disease to all his daughters and to none of his sons. because it is not through Y chromosome that is occurring the disorder. Example, hypophosphatemic rickets. This is the pedigree showing the sex-linked dominant pattern of inheritance. You see, the father is affected, all his daughters are deceased, none of his sons are affected by the X-linked inheritance. Remember, X-linked inheritance, father never transmits the disease to his sons. Okay? But mother transmits the disease to his sons if the mother is carrier. Then, in third generation again, there are male and female affected because in sex-linked dominant, both are affected. Male as well as female are affected. What is multifactorial inheritance? In this particular pattern of inheritance, disease is the product of multiple genetic and environmental factors. That's why it's called multifactorial inheritance. The disease is due to the factors genetic as well as the environmental. Genetic factors heterogeneous and mostly unknown. Liability liability genes predisposed to an anomaly or disease. Okay? If the individual is having the genes which are liable, that results in a structural anomaly or the disease. Threshold for liability is transmitted by genes. Okay? Environmental factors move the threshold to left or right. For example, valproate in neural tube defects moves the threshold to left. Thereby, child is affected with smaller genetic predisposition. So valproic acid has got the tendency to cause the disease in the newborn with regard to neural tube defects. Whereas administration of folic acid will reduce the risk of developing this particular anomaly. Threshold moves to right if folic acid is given. Okay, this is how the multifactorial inheritance is influenced by the environmental factors, and the shift of the threshold from susceptibility to protection by the environmental factors, even though there is genetic tendency. Features: similar rate of recurrence. Recurrent risk is related to the incidence of the disease. Some have sex predilection. In identical twins, occurrence is higher than in non-identical twins. Risk of recurrence increases if multiple family members are affected. If the disease is severe, the recurrence rate is also high. These are the features. What are the disorders of multifactorial inheritance? In children, neural tube defects, cleft lip, cleft palate, club foot, cortical defects, these are all multifactorial inheritance disorders, whereas in adults, diabetes mellitus, hypertension, coronary arterial disease, okay, etc. Stroke, to put another example, schizophrenia. These are the multifactorial disorders. Non-traditional pattern of inheritance. What are the disorders in this particular category? These disorders are caused by mitochondrial DNA abnormalities. There is a mutation in the mitochondrial DNA. There is nuclear DNA and mitochondrial DNA. Okay, mitochondrial DNA manifests as a with a non-traditional pattern of inheritance. What is a non-traditional pattern of inheritance? A single large deletion or point mutation in DNA produce the disease. Defects seen in one or more organs like brain, eyes, and muscles. Mother transmits the disease to the offspring irrespective of the sex. Okay? These mitochondrial disorders are transmitted by mothers to the offspring. Now coming to the chromosomal disorders, a brief touch on this particular topic. What is the chromosomal number and the terminology used? You have 23 pairs of chromosomes, 22 pairs of autosomes, one pair of sex chromosomes. Okay. Haploid state is defined as cell with 23 chromosomes. Okay. What is the haploid state? Haploid state is cell having the 23 chromosomes. What is the diploid state? Cell with 46 chromosomes. Otherwise, 23 pairs of chromosomes. Out of which 22 are the autosomes and one pair of sex chromosomes. This is diploid state. What is euploid? Cell with multiples of haploid chromosomes is euploid. That could be diploid or anything, the multiples of haploid chromosomes. What is aneuploidy? Any deviation from multiples of haploid is called aneuploidy. What is polyploid? Multiples of haploid with more than diploid, okay, is polyploid. What is triploid? 3 copies of each chromosome. When it is there in one cell, it is called triploid state. It is seen in 0.4% of live births. You understood the definition of various terms? Let's go ahead. Common causes of mental retardation. Chromosomal aneuploidy is common cause of mental retardation. Common cause of congenital anomalies. More common in spontaneous abortions and stillbirths. Abnormal phenotype is the result of imbalance in genetic material. Okay? Numerical and structural abnormalities of the chromosomes can result in abnormal phenotype. Okay? Look at the chromosomal number and their definitions. Haploid is the state of 23 chromosomes in cell. Diploid is the state of 46 chromosomes in the cell. That is 23 pairs. Euploid is the multiples of haploid. Okay. Aneuploid is the deviation of the number of chromosomes other than haploid or diploid. Any deviation from the normal diploid pattern. Polyploid is the multiples of haploid other than diploid. Okay. These abnormal chromosomal anomalies, okay, is the most common cause of mental retardation. They present with the different phenotype due to the imbalance or excess of genetic material. Look at this particular picture showing the Karyotype. Look at the chromosomes 1, 2, 3, 4, 5, 6. In this, the X chromosome, and there is Y chromosome. This is the karyotype of a normal male. Coming to the chromosomes and its morphology. Chromosome has got short arm and long arm. Short arm is represented by P, long arm is represented by the letter Q. Centromere, the point that connects the long and the short arms. When the centromere is close to the center of the chromosome, it is metacentric. If it is a little away from the center of the chromosome, it is submetacentric. And if the centromere is towards the end of the any arm, is called acrocentric. Autosomal aneuploidy. This is the most common. This is the abnormalities of the numbers of the chromosomes. They are monosomy and trisomy. Monosomy is the situation when the cell contains one copy of the chromosome in diploid cell. Cell is a diploid, but it has got single copy of the chromosome. But chromosomes occurs in pairs. But in monosomy, with that particular number of the chromosome, it has got one chromosome only. It does not have the pair. This particular situation is lethal. Autosomal monosomy is lethal. Okay? Trisomy. There are three pairs of autosomes. We are talking about autosomal aneuploidy. So autosomal monosomy is lethal. The baby won't survive. Trisomy, you know very well. There are three copies of the autosomes. For example, it could be 21, that is Down syndrome, the chromosome 18 or chromosome 13. With regard to sex chromosomal aneuploidy, again, it could be monosomy or trisomy. Monosomy with regard to X chromosome, the example is Turner syndrome. Trisomy with regard to X chromosome, with two copies of the X chromosome with one Y, is called Klinefelter syndrome. Well, what are the causes of aneuploidy? It could be non-disjunction, it could be translocation, or it could be inversion, or it could be deletion and duplication. Okay? These are the terms used in order to explain the mechanism for abnormal number of the chromosome. That is chromosomal aneuploidy. Non-disjunction means the pairing of the chromosomes prior to the cell division and are not moving to the opposite poles. They move together, thereby resulting in the aneuploidy in one of the cells during cell division. This is because of the stickiness of the pair of chromosomes. This situation is called non-disjunction. Translocation. When one part of the chromosome is broken at point at the centromere and is relocated onto the another chromosome, thereby increasing the genetic material in the cell receiving the segment of the chromosome from the another cell to the other. This is called translocation. Okay, it could be inversion, it could be deletion and duplication. That results in the addition of the genetic material in one cell with the depletion of the genetic material in another cell, the cell deprived of the genetic material is not going to survive. The cell with the additional genetic material is showing the abnormal phenotype. Okay. Coming to the cell division, mitosis, meiosis. Mitosis is the cell division with the daughter cell receiving the equal number of chromosomes. Meiosis is again divided into meiosis 1, meiosis 2. In meiosis 1, there is reduction in the number of chromosomes, and the daughter cells they receive the half of the chromosomes from the cell which is getting the meiosis. In meiosis 2 division, 2, there is again mitosis of the mitotic phenomena producing the two more daughter cells with haploid number of chromosomes. That's it. An example of chromosomal anomalies is the Down syndrome. Most common genetic cause of moderate to mild to moderate mental retardation. Occurs in 1 in 775 live births. Very common. Common in elderly mothers. Okay. High risk mothers should offer antenatal checkup. Okay. Common in my elderly mothers. Mothers with the advanced age, they are more at risk to give birth to children with Down syndrome. That's the reason why high risk mothers should be offered antenatal screening. Typical phenotype associated with anomalies, metabolic abnormalities, and other risk factors that determine the morbidity and mortality. What are the genetic features of Down syndrome? That is otherwise called how the abnormality of the trisomy 21 leading to Down syndrome. Its pathogenesis. What are the causes of trisomy 21 leading to Down syndrome? It could be due to non-injection. It could be due to mosaicism. It could be due to translocation. Non-injection is responsible in 95% of the cases. Well, what are the risk factors for non-injection? Elderly mother, more than 35 years. Meiosis 1 non-injection is common. It is preconceptional. Okay? That means when the ovum being formed, okay, the ovum with the additional genetic material gets fertilized by the sperm with haploid number of chromosomes. As a result of non-injection, the ovum is receiving, one of the ovum is receiving normal 21 chromosome and a abnormal 21 chromosome. That is a segment of the 21 chromosome. That is long arm of the 21 chromosome is remaining or a total 21 chromosome is remaining in one of the daughter cells. Okay, that means a pair of 21 number chromosome and rest of the chromosomes in normal number are there in the ovum due to non-disjunction. Okay, then that ovum receives the sperm with normal 23 chromosomes. Okay, so 23 chromosomes and one added to that in the ovum, okay, forms the zygote with normal pattern of sperm, normal number of chromosomes having with the sperm, thereby resulting in the additional 21 chromosome in the fertilized egg. Okay, that's how the trisomy 21 results because of non-disjunction. Mosaicism, that is, this is the post-fertilization event, okay, that results in the aneuploidy. That is, in 1% of the individuals. Translocation is responsible for in 4% of the cases of Down syndrome. Okay. Then translocation is described as proportional translocation, which is preconceptional again. That could be 13, 14, 15, and 21. This is otherwise called DZ translocation. Occurs in young mothers. Okay, this is the Robertson translocation is the balanced translocation, and the mothers are the translocation carriers. Okay, and recurrence is more common in this particular situation, and they manifest with abnormal phenotype, mental retardation, other anomalies like cardiovascular system, GAT, endocrinal, immunological, and also neoplasias. Phenotypically, they will be having brachycephaly, depressed nasal bridge, epicanthic folds, upward slanting of the palpebral fissure, okay, white spots on the iris, that is called brush field iris, hypotonia, clinodactyly, simian crease, are the other features of Down syndrome. Out of all these things, the most important feature that should be remembered is upward slanting of the palpebral fissure. Okay, this is the most important feature in the phenotype of Down syndrome. What are the anomalies common in Down syndrome? Endocardial cushion defects, duodenal atresia, hypothyroidism, pelvic dysplasias. Okay, there is increased gap between the first and second toe. Leukemias are more common and immunological. They suffer from immunodeficiency situations. How do you come to diagnosis? You can make the diagnosis antenatally. All the mothers at high risk are at the matter. Nowadays, every mother is screened with for alpha fetoprotein, which is diminished, beta HCC, SCC, human coronary gonadotropins, they are elevated. Free estradiol is diminished in Down syndrome. Pregnancy associated plasma protein is diminished. Amniocentesis is advanced, and then postnatal karyotyping is indicated for the diagnosis. amniocentesis for chorionic well-line sampling. How do you manage? There's no cure for this because it's a chromosomal anomaly. You give supportive care and rehabilitation. Okay. This is the picture showing the features of Down syndrome. You see the clinodactyly. There is the interning of the little finger. The risk factors I've already told you. It is the maternal age, parents with the translocation carrier, one sibling with Down syndrome. These are the risk factors for Down syndrome. Maternal age, more than 35 years, parents with translocation carrier, they are at risk of getting the, because they are asymptomatic and they transmit the anomaly to their offspring. One sibling with Down syndrome is again a risk factor. What are the complications? Complications of cardiac anomaly, GA disorders, immunological, more prone for malignancies, endocrinopathies like hypothyroidism, sleep apnea, spinal anomalies, sometimes obesity, ear infections, vision and the hearing problems are the some of the complications that Down syndrome may suffer. Well, this is all about the genetic inheritance and some of the chromosomal abnormalities. We touch in detail about the Down syndrome because we frequently see the children with Down syndrome, and we touched about the aneuploidies, right? About the genetic disorders, the important aspects of the genetic inheritance we discussed in detail. Well, I hope this video is going to benefit the students. Thank you very much for patient listening. I'll see you again in the next class. Until that time, bye bye. If you like my video, please subscribe to my channel and thank you one and all. Bye bye.